The prevalence of alcohol use disorder has been increasing nationally. COVID-19 has contributed to this trend. Approximately 56% of adults report increased drinking since the start of COVID-19. Currently, the 12-month lifetime prevalence of AUD in the United States is 8.6%. Alcohol use is accountable for 3.8% of global deaths and 4.6% of global disability. The costs associated with alcohol use total an estimated $24.6 billion annually. Unfortunately, alcohol use disorder is associated with low success rates for long-term abstinence. However, there are safe and effective treatments available that are underutilized. Only 6% of adults with alcohol use disorder use pharmacological treatment methods. Similarly, only 13% of providers report prescribing naltrexone for alcohol use disorder. The four main barriers contributing to this trend include low patient demand, pharmacy and formulary restrictions, lack of provider knowledge about naltrexone, and lack of confidence in the effectiveness of pharmacological treatment for alcohol use disorder. Naltrexone is approved by the FDA for use in alcohol dependence and opioid addiction. Naltrexone comes in scored 50 milligram oral tablets and a long-acting injectable. Naltrexone decreases alcohol cravings by blocking opioid receptors in the reward center of the brain. Opiate receptor antagonism in this part of the brain decreases dopamine release, which dampens the rewarding effects of alcohol use. The most common side effects include headaches, nausea, somnolence, and vomiting. The FDA has issued a black box warning for dose-related hepatocellular injury associated with naltrexone use. Therefore, it is important to monitor liver function before starting naltrexone and during maintenance treatment. The literature indicates that naltrexone is a safe and effective treatment for alcohol use disorder. The use of naltrexone is associated with an 83% reduction in heavy drinking and a 4% reduction in drinking days. In a systematic review, the side effects of naltrexone were concluded to be minimal and mostly gastrointestinal. The long-acting injection formulation has also shown efficacy in decreasing the median number of drinks consumed per day. Inpatient education about naltrexone is associated with reductions in 30-day emergency department revisits. There are several characteristics associated with greater efficacy when using naltrexone. First, reward drinkers that use alcohol because they like the feeling of being intoxicated have been shown to have more benefits from naltrexone than those who drink alcohol for relief from their daily stressors. Additionally, nicotine users have better results when prescribed naltrexone for alcohol use disorder. Patients with severe liver impairment and those actively using prescription or non-prescription opiates are contraindicated for treatment with naltrexone. Concurrent use of opiates with naltrexone is known to precipitate opiate withdrawal. Despite proven effectiveness, naltrexone is underutilized in the treatment of alcohol use disorder. Only 2.8% of patients with alcohol use disorder receive a prescription for naltrexone. Simple interventions can increase the utilization of this medication. Talking with a healthcare professional about alcohol use predicts patient openness to evidence-based treatments. Similarly, patient and provider education about naltrexone can significantly increase the number of prescriptions for this medication. Specifically, hospital-initiated counseling and provider education is associated with increased naltrexone use. Nurses, providers, and clinical social workers play a fundamental role in educating patients about their treatment options. Alcohol use disorder is a highly prevalent disease and is associated with negative health outcomes and high costs. Naltrexone is a safe and effective treatment for alcohol use disorder, but is highly underutilized. Healthcare professionals play a fundamental role in educating patients about their treatment options. Both patient and provider education about naltrexone is associated with increased utilization.